Just some staggering numbers from the medical examiner's office tonight, showing the most drug overdose deaths in Denver County ever recorded. And digging into those numbers, preliminary data shows 522 overdose deaths in 2023. The year before that, 453. And more than half of the fatal overdoses last year were fentanyl related.
2023's number is likely even higher. The medical examiner's office tells us there are still around 100 deaths awaiting toxicology results. Tonight, Denver 7's Colette Bordelon talked with one woman who puts a face to those numbers.
So this here is my brother Kevin, and me in the middle, and then my mom.
Pictures from birthday parties.
And then this one's all three of us.
Or random road trips.
We were all a year apart, and so we did everything together.
Our memories Brooke Perez never wants to forget, like dancing with her brother Kevin, while her sister Crystal laughed from behind the camera.
Feels like it was just yesterday.
Everything changed in 2017.
I lost my sister to a drug overdose. And then in 2020, I lost my brother to a drug overdose. Her and Kevin struggled with addiction for over a decade.
Still nothing could prepare her when the late night phone calls from her mom came.
And she said, well, it's Kevin. And I said, no, it can't be. You know, I didn't just lose them, I also lost a part of me.
2023 saw the highest number of overdose deaths ever recorded by the Denver Medical Examiner's Office, 522. That's more than double what we saw 5 years ago.
I wasn't very surprised, honestly, to see how much they had gone up. We could feel that workload here all year.
Dr. Sterling McLaren, the assistant medical examiner, says the biggest problem comes from multi-drug use, specifically when fentanyl is combined with methamphetamine. Around 65% of the drug overdose deaths from last year were fentanyl related.
Had we given Narcan, would this person who died from fentanyl and methamphetamine still be alive? It's really hard to say.
Perez believes drug addiction doesn't get the attention it deserves because of the stigma attached to it.
I feel like if that stigma was erased, eradicated, if it was gone from our society and people were more helpful and welcoming to this disease with mental health as well, where would we be? What would that look like?
Vowing to make sure her siblings are always seen as more than just a statistic. Colette Bordelon, Denver 7.
Perez started a nonprofit in honor of her siblings called KK Fearless. It raises money for treatment facilities. A link to their website and how to support their efforts is on denver7.com.
And digging deeper into this issue here, overdose deaths on the rise in Denver's unhoused community. Last year, nearly 3 out of 4 deaths among people experiencing homelessness caused by a drug overdose. These numbers are also preliminary and could be also much higher. Now, law enforcement is also sounding the alarm on a deadly drug detected for the very first time in Colorado. 2 overdose deaths in Boulder County tied to the drug nitazene, a painkiller experts say is even more potent than fentanyl.
It's important that folks are keeping their eyes open out there, testing their drugs, always having naloxone on them, and being in company when they're using their drugs. Don't do drugs alone, especially now.
Nitazene was created in the 1950s, but it never was approved by the Food and Drug Administration.
So what's being done to prevent overdoses in our community? Let's start with what our lawmakers are doing and recent overdose prevention legislation. And at the federal level, Representative Brittany Pedersen introduced a bill to Congress that would make Narcan more accessible to patients who are leaving the hospital after overdosing. Right now, there are restrictions on sending the drug home with patients. Under the proposed act, those restrictions would be lifted for high-risk patients and force all health coverage plans to cover the cost. On a state level, a new law gives immunity from arrest to those who overdose or those who help someone who overdoses. Meanwhile, Denver Health is taking action against harmful drug use in our community. Over the summer, it expanded its 24/7 methadone treatment program to respond to the crisis. It also adopted how it uses treatments based on the type of opioid. So, for instance, fentanyl use requires a higher dosage of Narcan. Denver Health also became the first licensed youth detox facility in the state. The 21-bed facility includes classrooms, fresh air, courtyards, and social events. An important part of preventing overdose deaths is having the tools to reverse one. You can order Narcan and fentanyl testing strips on the city's website. The overdose fighting tools are available for anyone who lives in Denver.